tried to get in, and when it said request, it didn't come back to me. So I said, I'll try it a different way. How
It's
are you?
quite all right. Thank you so much for joining us. So
Thank
I
you.
have already highlighted what we will be talking about, and I shared with our viewers that you are Dr. Kelly Cleary. You are the medical director of at FAIR Food Allergy Research and Education, and that you are also a seasoned food allergy mom. You have a 13-year-old food allergic child, and I'm so happy to join in this discussion with you this evening. Is there anything else you'd like to share, Dr. Cleary?
No, I'm really happy to be here and excited to be having this conversation. Such an important topic.
Yes, ma'am. Well, one of the things that I mentioned were the two topics that we're going to be covering this evening, of which are very near and dear to my heart: health disparities in food allergy and the critical need for representation in the food allergy space. Most importantly, for the audience members, I really want you all to know that we want to hear from you. After we go through the round robin questions with Dr. Cleary, there will be a small window of space for you to drop your comments or your questions into the comment section, with the hopes of us being able to answer your questions before the conclusion of our round robin. So, in an effort of time, let's hop into the first question,
Great.
Dr. Cleary. What have you learned about food allergies in Black, Hispanic, and Asian individuals? Are they more or less common? Are they more or less severe?
So yeah, we have noticed, there are a lot of health disparities within food allergy that we really need to address because food allergies affect 33 million Americans. And when we're recognizing that not every individual with a food allergy has the same course of treatment, that's someplace that FAIR really wants to step in. So what we're seeing is that Black children are actually at a higher risk of developing food allergies. And then on top of that, we're seeing that non-Hispanic Black children and adults are more likely to have multiple food allergies. So when that happens, you can imagine multiple food allergies, they do increase the severity of what your course is like, right? You may have more reactions. You certainly have more, foods that you are avoiding and substituting, and it just there's more opportunity to kind of have an accidental ingestion. We're also seeing that in some cases we're finding that there's less epinephrine prescribed because these kids are not getting in to see, a physician where their allergy is diagnosed and they're getting epinephrine. So there's lots that we have to do to kind of catch up there.
Yeah, there are so many folks in our food allergy community who definitely understand and agree with what you're saying and have experienced just those things. So thank you for sharing that. What unique challenges do underrepresented or underserved communities face related to food allergies?
So one of the things that it was actually a study that Dr. Ruchi Gupta did, and she looked at all of the allergists who accepted Medicaid and actually found that only half did. So if you saw that map of the United States and where allergists with Medicaid are located, there are areas that have no one, right? So that right there causes a lack of access. So that's one. And secondly, we're also finding that sometimes there's a later diagnosis. And again, that has to do with access. It has to do with long wait times that we're seeing. Sometimes we're seeing that, for populations that there may be language barriers. So imagine, I did my training in emergency medicine, and I admittedly now wish I could turn the clock back to having a child with food allergies, in the beginning, because if I diagnosed a new food allergy, I would prescribe epinephrine and then very hastily give those, instructions on how to use it. That's not the right answer, right? And I think that it's now taken me as a mom with a child with food allergies to recognize that you need a little bit more. So I think that, the fact that we're seeing that our Black and Hispanic populations are going to the ER more. Well, ER care, I love it. I'm an ER at heart, but you're not getting that same attention that you'd be getting if you went to an allergist or your pediatrician or your general practitioner.
Sure. And thank you for the Ruchi Gupta. We will make sure we research that following
Yes,
this live. That's a
yes,
great
she's
tip. Um,
wonderful.
so what can we do food allergy healthcare practitioners, food allergy community members, parents. What can we do to promote better equity in food allergy awareness and food allergy care?
So I think the first thing, and you'll hear me say this for so many of the issues within food allergy, but it's awareness and it's education and it's letting people, even within the medical field, know that these disparities exist. It's about letting that HCP in, where there are no allergists, that healthcare professional where there are no allergists, know to probe a little further, ask questions about food insecurity, ask about how they're managing. How would you manage in this situation? Do you know when to use epinephrine? Do you know how? I know you probably know when we go food shopping. I mean, my son is allergic, and at some point was allergic to a lot more, but is allergic to eggs, peanuts, and shellfish. And I remember way back when he was allergic to so much more, to buy a box of cake mix was almost $9 or $10, like just to have an allergy safe cake mix for his birthday. That's for the special stuff. If there are families out there who can't afford to get the stuff that is the substitutions for, a cheese if someone has a dairy allergy, or there's just so much that I think awareness can help bolster, because with awareness, people within the medical community will know that there are more questions to ask. I think we've got to have a better push towards having diversity in clinical trials, because that's another place that we are not seeing it. I think, we have to be just trying to do it in any way, expand access to these, specialty care and to meds. So I know at FAIR we're working hard on that. One of my colleagues, Anita Roche, actually heads up this Fair Neighborhoods initiative, and she and her team are going into neighborhoods where they may have been underserved in the past and may have had a lack of access, and they are finding that just by being in the program, the rates of epinephrine prescription are skyrocketing. Right? I mean, that alone just makes you say sometimes it really is education and awareness. So I think it all goes back to that.
I love that. And I love Anita. The work that she is doing is amazing. And I hope to aspire to the work that she does. And I hope that I am an appropriate representation of all of the things that she is doing behind the scenes at FAIR, because this matters. I always say before I speak or say anything about food allergies that I speak from a place of privilege, because for now, we can afford those things that we need, those necessities and those essentials. So we have a few more minutes, and I have one more question for
Sure.
you, Dr. Cleary. What resources would you recommend for people who face food allergy challenges due to their race, culture, or language?
So again, I would start with resources that teach about awareness and education. So if you go to foodallergy.org, we've got tons of resources on how to give epinephrine, when to give epinephrine, what are signs and symptoms. But then I think there are a lot of things where you can go a step further, and it's for communities that how we personally can look for resources. And I know Anita's team, there's constantly need for going into communities and being that person who's teaching and doing a class at night, and teaching newly diagnosed parents, what does that mean, and how do you need to manage, how do you need to read these labels. So I think that there's so many resources online, and then there are resources that we ourselves can go and find and really get ourselves involved.
That's fantastic. So we have about 3 more minutes before my session comes to a close. And before we hop into viewer questions, audience questions, if you have them, please add them into the chat. I would like to ensure that I invite you all to attend the next session that starts with one of my food allergy community members, Sarah Fry. You can find her at Food Allergies OTG. And I want to remind you all that this live will be saved on the Vindico Education Live Instagram, and I will also have it saved on my Instagram just in case you want to refer back. So if you do have questions, I will read one of them. The first question asks or states that I am severely allergic to egg. Are there any affordable or reasonably priced substitutes for egg?
So you can buy some of the store bought, and egg I'm very familiar with because that is my son's nemesis. And I've actually just looked for, I could say to you, I've never used those over the products that are true egg replacers. I know so many people that do. It just wasn't something that I looked for at that time. But there are egg replacers. You just have to very carefully read that it does not have any egg product in it. But I have found just through like dappling with my, with my cooking, and I'm by no means a good cook, but trying to find things that I could substitute eggs for. So if I'm baking a cake rather than eggs, I will use Greek yogurt. And that will keep that cake together. And there were times when I would be trying these recipes, and I remember once for my dad's like 65th birthday, I made a cake that as soon as we cut it, the entire cake collapsed. That wasn't the right substitute. So I just had to go and find what kind of thing. I found that, things like applesauce sometimes work. But if you're baking, one of the best things is Greek yogurt.
Fantastic. Story of our lives as moms. The last question is asking about food allergies in schools. So I definitely recommend you hop over to Food Allergies OTG, where she will be discussing the importance of ensuring access to food allergy care in school-aged children. And a reminder that this live will be posted on the Instagram and YouTube feed of Vindico Medical Education's sites. Dr. Cleary, thank you so much
Thank
for
you for
joining
having
us.
me.
I know you have to run, but you have really hit home with a lot of your questions, and I can't wait to join you on Food Allergies OTG.
Thank you.
Thank
Thanks for having me.
you. Bye.